Before the pandemic, around 1 in 10 UK adults experienced some form of depression. Since the outbreak, that number has doubled, with 1 in 5 adults having symptoms of depression. In England, the economic and social cost of mental health has ballooned over the last decade to a whopping £119 billion a year. But GPs say that 40% of their consultations now involve a mental health condition, and the number of referrals to mental health services have dropped during the first lockdown by 57%. 1 in 4 have had to wait 3 months or more for mental health help, with experts warning this could be made longer due to the pandemic. 44% of respondents who have received NHS therapies in the last 12 months felt they waited too long to receive them. The problem is at its most acute in the workplace. In 2019-2020, stress, depression or anxiety accounted for 51% of all work-related ill health cases and 55% of all working days lost due to work-related ill health. Poor mental health in the workplace costs private companies nearly £1,700 per employee in absenteeism, presenteeism and reduced productivity. That was before the pandemic. Some organisations offer employee assistance programmes featuring face-to-face therapy, but often times they are met with an inappropriate or substandard solution, or failure to provide any assistance at all. SupportRoom's employee support platform, however, is different. SupportRoom supplies immediate access to a therapist over our in-app messaging platform, while offering businesses anonymised data that helps them understand where and why mental health problems are occurring within the organisation. The COVID-19 pandemic has created the most stressful year in history and negatively affected the mental health of 78% of the global workforce. 76% of people believe companies should be doing more to support the mental health of their workforce. SupportRoom's focus on in-app messaging provides immediate and ongoing support for people who might otherwise suffer in silence.
In 2019, my cousin committed suicide, tragically. He didn't get the right level of support that he required. He suffered in silence. After this happened, it made me really think about what can I do to support others, to deter and help those that are going through similar symptoms to not commit suicide. Now, I looked at the space and looked at all of the problems that sat within the space, and some of those were astonishingly shocking. By looking at those problems, we started to look at how we could create technology to really transform and support those that are suffering with mental health symptoms. One of the biggest things that we found was that appointments and waiting times within private health, but also within the public sector, were anywhere between 2 weeks all the way up to 18 weeks. Now, we all know that if mental health is not treated in the moment, just like any other symptom, it gets worse over time. So we really wanted to create an on-demand platform that enabled employees, individuals, whoever it is, to get support in that moment from a clinical therapist. We wanted to evolve the whole space by not only providing support, but also providing clinical data analytics that enabled an individual to understand their well-being today, but also over time, to understand how those improvements were actually improving over time. So we built SupportRoom, and today our technology is going to help to transform the mental health space, and it's my mission to help those that are suffering.
With SupportRoom's in-app messaging, we can connect anyone to a qualified therapist in less than 90 minutes from any device. And that relationship isn't confined to an hour a week like traditional therapy. Our therapists are there to support their patients whenever they need the help.
I was approached as a financier for this project about 15 months ago. Having created and scaled my own recruitment business from the ground up, I'm well versed in understanding the challenges around facilitating a rapid growth environment for service-led businesses. SupportRoom solves a real issue that's prevalent across the globe, and even more so during these COVID times. To date, we've verified more than 600 therapists, all of whom are ready and willing to use our platform. The feedback we've received from the core therapists who are currently active on the platform is phenomenal and supports the idea that SupportRoom offers a much needed medium to make therapy more accessible for all.
SupportRoom gives us an opportunity to dive deep into the client's inner world safely and effectively. As a therapist, the platform gives us freedom and flexibility to choose our hours, letting clients know when we're online. The platform tools allow the clients to track their mood using a journal to record their thoughts, helping them notice patterns or trends and helping us as therapists to gain insight that we can use to help the client more quickly. In addition to online counselling with a therapist, the site also offers self-help articles by qualified professionals and interviews with mental health advocates to raise awareness and educate people on various common issues people struggle with in life.
The SupportRoom progression tracking tools are invaluable as a function of any employee assistance program for organisations. Most programs in this space provide support for individuals, but the company themselves get very little feedback, meaning that leaders and management really understand the root causes of stress, depression and anxiety within their organisation. As someone who helps organisations globally with HR transformation, I see and implement many different technology applications, and I can safely say that SupportRoom is one that I'm enthusiastically endorsing.
The principal driver in our financial strategy at SupportRoom was offering affordable therapy for people who can't afford traditional face-to-face therapies. Even at a low price, we can sustain healthy unit economics. We also wanted to build a way for companies to offer therapy to their employees. Together, these create the foundation for a large, scalable, and valuable business.
I'm really proud to be part of SupportRoom. Having facilitated the growth of a healthcare deep tech AI innovator, as well as a global world tech company, I have a deep understanding of what it takes to make companies successful in the health tech space. I wanted to be part of this exciting disruption of the mental health sector because I can see huge potential for growth. For me, SupportRoom is launching not just a digital mental health platform, but innovation in treatment.
Hello, my name is Dr. Matthew Knight. I'm a respiratory consultant with an interest in virtual medicine. Over the last couple of years, I've been leading the virtual respiratory services at Medifer Limited, and in March 2020, with my colleague Andy Barlow, set up the COVID virtual hospital service, a model of care that has now been rolled out across various parts of the United Kingdom. In my specialty, respiratory medicine, like many others, poor mental health contributes to poor disease management. I'm delighted to support SupportRoom in rolling out their new services with a mission to provide expert evidence-based mental health interventions to all those in need at the moment of need.
Support when you need it, 24/7 access. Correspond through text, voice or live video, all in the same app. Our subscription model works out to be way more affordable than traditional therapy. No waiting, no judgment, just real therapists. Analytics tools that help clients track their progression. Ongoing support, an always-on platform for speedy support. SupportRoom went live on January the 21st, 2021 with a soft launch, using social media to publicise the launch. Since then, 600 plus therapists signed up to provide services, 450 plus clients signed up for support services, a B2B pipeline in excess of £700,000, 6 agreed partnerships signed off, 2 of which are global fitness organisations. 1 is a leading employee benefits and HR technology company. We also have advanced conversations with 2 of the largest insurance brokers in the world who are assessing our platform as both clients and partners. 2 B2B contracts agreed. We've added to our senior team of clinical advisors with the introduction of Dr. Matthew Knight. Dr. Matthew holds an MBE, and has considerable experience in building a fully virtual hospital with Medifer, a company he helped create in 2013. He will be helping us build our virtual mental health clinic, which will be created to service our B2B clientele. SupportRoom offers an excellent opportunity to invest in the potential future of mental health support. While we support individuals in the B2C market, we consider our principal area of growth to be the huge B2B market, offering mental health support to employees to increase retention, bolster flagging morale, and significantly augment productivity. Bolstering workforce mental health is the #1 priority for HR departments across the UK. SupportRoom's founders and advisors have extensive sales experience of B2B products, especially in HR departments. Our financial infrastructure is capital efficient, having signed up over 600 therapists to date and launching B2C and B2B products with no outside investment. With this raise, we aim to finance our first 18 months while we develop relationships and cement contracts with SMEs and large organisations, also enabling us to mature a large B2C presence. SupportRoom's platform is up and running and already helping individual clients. With your help, we aim to penetrate the vast organisational market. SupportRoom. Make therapies available, affordable, and provide ongoing support for all.